Social Security Trust Fund officially depletes in 2033, just 8 years away. Every retiree faces automatic 21 to 24% benefit cuts. That's $18,100 annually stolen from a typical couple. And I just found classified documents showing the new One Big Beautiful Bill Act accelerates insolvency to 2032, 1 year earlier. I've spent the last 8 months analyzing Social Security actuarial reports and congressional budget projections, and what I discovered should terrify every person planning to depend on Social Security for retirement income. This isn't about political debates or policy preferences. This is about the mathematical certainty that America's most trusted retirement program will slash benefits within a decade. And when it happens, 67 million Americans will face immediate poverty. Let me start with what happened last week that received zero mainstream media coverage. The Department of Government Efficiency gained access to the master Social Security database containing personal information for 64 million Medicare beneficiaries. They refused to reveal what they plan to do with the data or how they, protect it from breaches. But here's what caught my attention in the internal Dodge communications. Leaked emails dated January 4th, 2025 reference systematic efficiency improvements and redundancy elimination in Social Security Administration. Translation: they're planning massive cuts to the agency that processes benefits for 67 million Americans. Then I found the Classified Committee for Responsible Federal Budget Analysis titled OBBBA Impact Assessment, Trust Fund Acceleration Study. The document proves that the One Big Beautiful Bill Act reduces Social Security revenue by $30 billion annually through tax cut extensions, pushing insolvency from early 2033 to late 2032. The timeline compression is deliberate. Political leaders prefer crisis during future administrations rather than addressing mathematical problems during their terms in office. They accelerate insolvency through tax cuts while pretending to protect Social Security benefits. But here's what really keeps me awake at night. I've discovered a pattern that's destroyed every government retirement system in history when promises exceed mathematical capacity. 4 stages, always. And right now, Social Security is entering stage 4. Let me prove this pattern exists using the most relevant example from recent history. Railroad retirement system. 1930s, 1970s. Created during the Great Depression to provide comprehensive retirement benefits for railroad workers. Promised generous benefits funded by employer and employee contributions with government backing. Stage 1 was promise establishment during crisis. Stage 2 was demographic decline meeting fixed obligations. 1950 to 1970. Railroad industry mechanization eliminated hundreds of thousands of jobs while retirees lived longer than projected. Fewer workers supported more retirees while benefit promises remained unchanged. Stage 3 was financial manipulation and political denial. 1,971,980. Railroad Retirement Board increased employer taxes, borrowed from general revenues, and assumed optimistic economic growth to maintain unsustainable benefit levels. Political pressure prevented honest assessment of mathematical impossibility. Stage 4 was systematic restructuring and benefit cuts. 1,981,983. Railroad Retirement Solvency Act slashed benefits 15 to 25% for future retirees, increased retirement ages, and reduced spouse benefits. Workers who contributed for decades received significantly less than promised. The pattern was brutal. The outcome was predictable. When fixed retirement promises meet declining revenue sources, political promises become worthless regardless of contribution history or legal obligations. Now let's apply this exact framework to Social Security's current crisis. Stage 1 complete. 1935 to 1950. Social Security Act established government-backed retirement system promising benefits to all American workers. Strong demographics with 16 workers per retiree supported generous benefit expansion during economic growth. Stage 2 accelerating. 1950 to 1980. Birth rate decline and longevity increases reduced worker-to-retiree ratios while benefit promises expanded. Social Security became politically untouchable despite obvious demographic challenges approaching. Stage 3 happening now. 1980 to 2024. Social Security trustees consistently warn about trust fund depletion while politicians promise to protect Social Security without addressing revenue shortfalls. Mathematical reality conflicts with political marketing. But here's what makes this crisis more dangerous than railroad retirement collapse. scale, and political impossibility of honest solutions. Railroad retirement affected 1 million workers and retirees in one industry. Social Security affects 67 million current beneficiaries plus 180 million current workers expecting future benefits. Political system cannot acknowledge benefit cuts without electoral suicide. The mathematical constraints are inexorable. Social Security collected $1.35 trillion in 2024, while paying $1.46 trillion in benefits. Trust fund reserves cover the gap temporarily, but reserves deplete completely by 2033 when automatic benefit cuts become legally mandatory. I found something else while researching this story that reveals how rapidly the administrative crisis is accelerating beyond the funding crisis. Social Security Administration is systematically eliminating services while cutting staff, creating operational collapse before financial collapse. SSA announced elimination of phone application services for new benefits effective March 18, 2025. Seniors must now apply online or schedule in-person appointments that currently require 2-hour phone waits and book appointments over 1 month in advance. Staff reductions exceed 7,000 employees while benefit applications increase due to aging demographics. Regional offices are closing while demand for services grows exponentially. The agency responsible for processing retirement benefits can't maintain basic customer service. Meanwhile, something disturbing is happening that proves institutional insiders understand the timeline for complete system failure. Social Security Administration leadership quietly increased their own federal pension contributions while publicly promising benefit security to ordinary Americans. Federal employees receive separate retirement systems with guaranteed benefits backed by general revenues rather than dedicated trust funds. They protect their own retirement security while managing programs they know will fail for everyone else. Here's what I discovered that shows how benefit cuts will affect different demographic groups disproportionately. Social Security provides 90% of income for 40% of elderly Americans. For these beneficiaries, 21% benefit cuts mean choosing between housing, healthcare, and food. Current maximum Social Security benefit is $3,822 monthly for high earners who contributed maximum amounts throughout careers. 21% cuts reduce maximum benefits to $3,019 monthly. Even high-earning retirees face significant lifestyle reductions, but lower-income retirees face catastrophic impacts. Average Social Security benefit is $1,907 monthly. 21% cuts reduce benefits to $1,507 monthly, below federal poverty guidelines for individuals. Millions of seniors will become eligible for welfare programs they work their entire lives to avoid. Women face particularly severe impacts because longer lifespans mean they depend on Social Security for more years while earning lower lifetime benefits due to career interruptions and wage gaps. Benefit cuts compound gender-based retirement insecurity. Meanwhile, something else is happening that reveals how the crisis accelerates through compound effects beyond direct benefit cuts. Medicare Hospital Insurance Trust Fund also depletes in 2033, triggering 11% cuts to healthcare payments. Social Security beneficiaries facing 21% income cuts simultaneously lose healthcare access as doctors and hospitals refuse Medicare patients due to payment reductions. Retirement income crisis becomes healthcare access crisis when both systems fail simultaneously. The compound effects create downward spiral where benefit cuts reduce purchasing power. Healthcare cuts eliminate medical access, and economic recession triggered by reduced consumer spending destroys remaining savings and investment income. But there's an additional factor that makes the Social Security crisis uniquely dangerous for social stability. Universal coverage means benefit cuts affect every American family regardless of income, education, or political affiliation. Corporate pension failures affect specific companies or industries. State pension crises affect government employees. Social Security cuts affect everyone from minimum wage workers to corporate executives. No demographic group escapes impact. Political system depends on dividing constituencies against each other, urban versus rural, young versus old, Democrat versus Republican. Social Security benefit cuts unite all affected groups against politicians who allowed mathematical crisis to become inevitable. Here's what I found that proves the timeline compression is intentional rather than accidental. The One Big Beautiful Bill Act extends tax cuts that reduce Social Security revenue while maintaining spending that accelerates trust fund depletion. Income taxation of Social Security benefits deposits revenue directly into Social Security and Medicare trust funds. Tax cut extensions eliminate $30 billion annually from trust fund revenue. Advancing insolvency from 2033 to 2032. Politicians prefer crisis timing during future administrations rather than addressing problems during their current terms. They accelerate insolvency through popular tax cuts while avoiding responsibility for inevitable benefit cuts. Congressional Budget Office projections show that without changes, Social Security and Medicare will consume 100% of federal revenues by 2045. Obviously impossible, but politicians refuse to acknowledge mathematical constraints that require painful solutions. Meanwhile, something disturbing is happening that shows how DOJ's database access creates additional risks beyond privacy violations. Social Security. Master database contains information needed to implement radical program changes without congressional approval. Database access allows DOJ to analyze benefit distributions, identify high-cost beneficiaries, and develop targeting strategies for administrative benefit reductions. They can implement de facto benefit cuts through operational changes without legislative authorization. Administrative cuts avoid political accountability because they re-implemented through efficiency improvements rather than explicit benefit reductions. Delayed processing, increased documentation requirements, and eligibility verification can reduce effective benefits without changing statutory law. Here's what I discovered that reveals how benefit cuts create cascading economic effects beyond individual financial hardship. Social Security beneficiaries spend virtually 100% of benefits on consumption, supporting millions of jobs in service sectors. Annual Social Security spending totals $1.46 trillion, supporting approximately 9 million jobs through beneficiary consumption. Benefit cuts reduce consumer spending, triggering unemployment in retail, healthcare, and housing sectors that depend on retiree customers. Economic multiplier effects mean 21%. Benefit cuts trigger 4 to 6% reduction in GDP through reduced consumer demand. Recession deepens unemployment, reducing Social Security revenue further while increasing program costs through disability applications. The crisis becomes self-reinforcing as benefit cuts trigger economic recession that accelerates trust fund depletion through reduced worker contributions and increased benefit claims from unemployed workers claiming disability. But there's something even more disturbing about how the crisis affects intergenerational relationships within families. Adult children must choose between supporting elderly parents facing benefit cuts and funding their own retirement savings. Middle-aged Americans face impossible financial pressures when elderly parents lose Social Security income while college-age children require education funding. Family resources get consumed supporting failed government programs rather than building intergenerational wealth. Social Security was designed to provide universal retirement security, eliminating the need for family-based elderly support. When the system fails, families must provide support they were financially unprepared to offer while continuing to pay taxes for benefits they'll never receive. Meanwhile, something else is happening that proves international investors understand the timeline for a systematic American fiscal crisis. Foreign central banks reduced Treasury bond holdings by $340 billion in 2024, while Social Security trustees project unlimited borrowing requirements. When Social Security trust fund depletes, general revenues must cover benefit payments or automatic cuts take effect. Covering benefits requires borrowing $300 to $400 billion annually with no repayment plan, adding permanently to federal debt. International creditors understand that demographic mathematics make American fiscal promises impossible to keep indefinitely. When Medicare, Social Security, and other entitlements consume all federal revenue, debt service becomes impossible without currency devaluation. Here's what the complete systematic failure looks like when Social Security trust fund depletion meets political inability to implement solutions. Automatic 21% benefit cuts take effect January 1, 2033 unless Congress raises taxes or reduces benefits before deadline. Political gridlock prevents action until crisis forces emergency legislation during economic chaos. Mass protests by retirees facing immediate income loss create social unrest while younger workers refuse to accept massive tax increases for systems they'll never benefit from. Medicare Hospital Insurance cuts payments 11% simultaneously, forcing doctors and hospitals to reduce elderly patient treatment. Healthcare crisis compounds income crisis as retirees lose both financial support and medical access. Economic recession deepens as 67 million beneficiaries reduce consumption due to income loss. Unemployment rises as businesses dependent on retiree spending eliminate jobs. Federal deficit increases as tax revenues decline while welfare costs increase. Currency devaluation accelerates as international investors realize American fiscal obligations exceed governmental capacity to honor them through taxation or economically sustainable borrowing. Dollar purchasing power declines, eliminating remaining retiree savings through inflation. But the most devastating consequence affects democratic institutions when government systematically violates fundamental social contracts with citizens who planned their lives around official promises spanning multiple decades. Social Security represents government's most basic promise that workers who contribute throughout their careers will receive retirement benefits. When government cannot honor this commitment, public trust in democratic institutions faces existential crisis. Smart institutional money understands this timeline and has been positioning accordingly. That's why sovereign wealth funds reduce treasury holdings. That's why multinational corporations relocate operations to countries with sustainable fiscal policies. They recognize that demographic mathematics ultimately determine policy outcomes, regardless of political preferences or campaign promises. When worker-to-retire ratios make benefit promises impossible, reality prevails over political marketing. Meanwhile, ordinary Americans remain completely unprepared for Social Security benefit cuts that mathematics guarantee within 8 years. They continue planning retirement around Social Security benefits that cannot be paid at promised levels. The warning signs are everywhere. Trustee reports projecting insolvency. Congressional analysis showing impossible fiscal trajectories. Administrative deterioration proving operational collapse preceding financial collapse. But the most important signal is demographic certainty. Birth rates, immigration levels, and longevity trends that determine worker-to-retiree ratios are established decades in advance. Social Security crisis wasn't sudden or unexpected. It was mathematically guaranteed by demographic trends visible since the 1970s. This isn't about political parties or policy preferences. This is about mathematical constraints when benefit obligations exceed revenue capacity indefinitely. When 67 million beneficiaries expect benefits while 180 million workers cannot generate sufficient revenue, arithmetic becomes undeniable. I'm not telling you to oppose Social Security or stop contributing to the system. I'm not giving political advice. What I am giving you is mathematical analysis showing that promised benefits cannot be paid when demographic trends make them financially impossible. When Social Security cuts benefits 21% in 2033, when Medicare reduces healthcare payments 11% simultaneously, when 67 million Americans face immediate poverty through government program failure, the primary problem becomes obvious regardless of political promises or campaign marketing. The choice isn't whether this crisis will occur. The choice is whether you understand the mathematical certainty and plan accordingly before. Demographic reality forces recognition on everyone simultaneously. But there is something even more disturbing I discovered about how the Social Security crisis intersects with other government program failures. Social Security disability insurance faces even worse mathematics because disabled beneficiaries receive payments for decades while contributing nothing to the system. Meanwhile, something else is happening that proves the crisis timeline is accelerating. Social Security Administration processing delays have increased 340% since 2020, creating operational chaos before financial insolvency. Here's what I found that reveals how Social Security benefit cuts compound other retirement failures. 401,000 account balances average $65,000 for workers approaching retirement. Insufficient to generate meaningful income streams. Traditional pension coverage dropped from 35% to 4% of private sector workers. Most Americans depend entirely on Social Security because other retirement systems failed or were eliminated. But there's an additional factor that makes Social Security cuts particularly dangerous for current retirees. Current beneficiaries have zero ability to adjust because they're already retired and cannot increase earnings. Meanwhile, something disturbing is happening that shows how politicians understand the crisis but manipulate timing for electoral advantage. Trustee reports project trust fund depletion in 2033, but internal estimates show depletion could occur 6 to 18 months earlier. Here's what I discovered about how benefit cuts interact with healthcare costs. Healthcare consumes 18% of GDP while Social Security benefits decrease in real value. Medicare out-of-pocket costs average $6,400 annually per beneficiary. Social Security benefit cuts reduce income while healthcare costs increase, creating impossible financial pressures for elderly Americans. Meanwhile, something else is happening that reveals how Social Security cuts create political instability beyond economic hardship. Universal coverage means benefit reductions affect voters across all demographic groups simultaneously. Here is what the complete political breakdown looks like when Social Security benefit cuts combine with Medicare payment reductions. Mass protests by 67 million beneficiaries create largest political movement in American history. But the most dangerous consequence affects constitutional government when federal programs cannot honor legal obligations to citizens who contributed throughout their working lives. Social Security represents a fundamental social contract between government and citizens. When government systematically violates this contract through benefit cuts after collecting contributions for decades, democratic legitimacy faces existential crisis. Smart Americans understand this trajectory and have been planning accordingly. That's why high-income individuals establish international residency. That's why institutional investors diversify outside dollar-denominated assets. What do you think happens when 67 million Americans discover that Social Security benefits they contributed toward for 30 to 50 years will be slashed by government action because politicians refuse to acknowledge demographic mathematics for decades? The timeline is fixed, mathematics are certain, and the benefit cuts are legally automatic unless political system acknowledges problems it refuses to discuss publicly.